Meta-analysis, a comprehensive guide. Overview. A meta-analysis is a structured research method that statistically combines results from multiple independent studies addressing the same question. It enhances precision and reliability beyond any single study. Crucially, it follows a systematic review, a transparent, reproducible process for identifying, selecting, and evaluating relevant literature to minimize bias. Defining the research question use the PICO framework. Population, e.g., older adults with osteoporosis. Intervention, vitamin D supplementation. Comparator, placebo. Outcome, fracture risk reduction. This ensures specificity and answerability. Protocol development create a detailed protocol outlining eligibility criteria, databases and search strategies, screening and selection methods, data extraction procedures, bias assessment tools, statistical models, planned subgroup, sensitivity analyses. Register the protocol in Prospero to enhance transparency, prevent duplication, and reduce selective reporting. Literature search conduct comprehensive searches across databases, PubMed, Medline, Embase, Cochrane Library, Scopus, Web of Science. Gray literature, conference abstracts, theses, dissertations, trial registries, clinicaltrials.gov, WHO ICTRP. Use Boolean operators. And narrows results, or broadens results, not excludes terms. Use parentheses for grouping, quotation marks for phrases. Example, PubMed search, vitamin D, mesh, or cholecalciferol, or ergocalciferol, and fractures bone, mesh, or bone fracture, or osteoporotic fracture, and aged mesh, or elderly or older adults, and meta-analysis T or systematics B. Document every search in a search log, e.g. Excel, noting, database, date, search string, filters, number of results, comments. Screening and selection use reference managers, EndNote, Zotero, Mendeley, Covidence, to remove duplicates. Screening occurs in two stages. 1. Title, abstract review. Full text review. Apply consistent inclusion/exclusion criteria. Record reasons for full text exclusions to support the Prisma flow diagram. Risk of bias assessment. Use standardized tools. Cochrane Risk of Bias. Tool for RCTs. Robbins. I for non-randomized studies. Assess domains. Selection bias, performance bias, detection bias, attrition bias, reporting bias. Data extraction extract into standardized forms. Study identifiers, author, year, country, design and sample size, participant characteristics, intervention, comparator details, outcomes and effect sizes, follow-up duration, study quality notes, statistical analysis effect, measures, choose based on outcome type, risk ratio, RR, probability comparison, odds ratio, OR, odds comparison, hazard ratio, HR, time to event comparison, mean difference, MD, or standardized mean difference, SMD. Continuous outcomes include p-values, probability under null hypothesis, confidence intervals, CI, typically 95%, narrower, more precise heterogeneity measured using I2. 12%, low, percent, moderate. 75%. High heterogeneity suggests variability in populations, interventions, or methods. Choose model accordingly. Fixed effect assumes one true effect. Random effects allows variation across studies, common in clinical research. Forest plots. Visual summary. Squares. Individual study effect estimates, horizontal lines, confidence intervals, square size, study weight, vertical line, line of no effect, e.g. RR1, diamond, pooled estimate, width, CI, publication, bias use, funnel plots, effect size versus precision, Egger's regression test, statistical asymmetry detection. Asymmetry may indicate missing small negative studies. Software options. RevMan, user-friendly, Cochrane standard. R, metaphor, flexible, powerful. Stata, comprehensive. Meta-analysis, advanced, commercial. JASP, open meta, analyst. Free alternatives. Reporting with Prisma. Follow Prisma guidelines. Flow diagram, study selection process, structured manuscript, introduction, background, rationale, objectives, methods, protocol, eligibility, sources, search strategy, selection, data collection, bias, effect measures, synthesis, additional analyses. Results, study selection, characteristics, bias, individual results, synthesis, heterogeneity, sensitivity, publication bias. Discussion, evidence summary, limitations, conclusions. References, formatted per journal style, e.g. Vancouver APA. Authorship and submission authorship requires substantial contributions. Design, data acquisition, analysis, interpretation, drafting, revising, final approval. First author, leads the work. Last author, senior supervisor. Choose a journal aligned with your topic. Specialty journals, open access options, BMJ Open, PLOS 1, submit via journal portal, manuscript, Prisma diagram, figures, supplementary data, cover letter.